Every year on November 14th, the world comes together to recognize World Diabetes Day, a global campaign that raises awareness about one of the most common and fast-growing health challenges of our time. This year's theme focuses on diabetes and the workplace. Today, we will be talking about what diabetes really means with a slogan, "Know more and do more for diabetes at work." The campaign's main aim is to increase knowledge about diabetes, create supportive work environment, reduce stigma, and promote healthy lifestyle for employees, as a significant portion of people with diabetes are of working age. You are with me, your host, Dr. Sue. Welcome to Consulting Room 5. We'll be right back after the break. You're welcome to Consulting Room 5 with me, your host, Dr. Sue. Today we have two very important personalities to discuss the World Diabetes Day with us. We have Dr. Kweku Yeboah-Kessy, who is the Medical Director of Royal Medical Agency Clinic, RMA, in Accra. Medical Director, you're welcome.
Thank you very much.
And we also have Darrell Naniyo Amwate, who is the Medical Representative of Unicom Chemist. He is the pharmacist of Unicom Chemist, one of the pharmacists actually. Yeah. So, Naniyo, right? Yes. Darrell, you're welcome.
Thank you very much.
So we have Naniyo or Darrell and Dr. Yeboah-Kessy, who are going to discuss the World Diabetes Day with us today, which commemorated on the 14th of November. Do you have cold or you have a dry cough? Don't let it slow you down. Reach for Lozati lozenges. Lozati brings fast, soothing relief with delicious flavors like ginger, honey, and lemon, peppermint, orange. And the bold new cola. Are you watching your sugar as we commemorate the World Diabetes Day? We've got you covered with sugar-free strawberry and sugar-free propolis, perfect for persons who are managing their sugar levels. Whether you are talking all day, working outside, or need comfort on the go, Lozati is your reliable companion. It's available now in all pharmacies and shops nationwide. Lozati lozenges, relief that works, flavors you will love, and options that care. Kivo hot pepper. Have you heard about the new pepper in town? Kivo hot pepper is the new pepper. It is now easier and faster to cook those spicy, delicious meals you love with Kivo hot pepper. You will feel like the heat and delicious taste is in every meal that you make with Kivo hot pepper. Get yourself some Kivo hot pepper today. Use it for your noodles, spaghetti, shito, stews, soup, you name it, and thank me later. It's available in various pack sizes that is convenient for home cooks, chobbers, restaurants, students, and many more. Kivo hot pepper. Moko sheesho. So you're welcome, gentlemen.
Thank you once again.
Thank you.
Okay, thank you. So when we talk about diabetes, what is it about, Doctor?
Thank you for the opportunity and greetings to your cherished listeners.
Right.
When we talk about diabetes, if I assume that we're talking about the more popular diabetes that we know, which is known as diabetes mellitus.
Okay.
As against the less popular one, less common one that we call diabetes insipidus.
Right.
Both have similar presentation, but of course, different etiology.
Okay.
The diabetes mellitus, as we know it, is a condition which arises as a result of the body's inability to metabolize glucose for energy. Nature has made it such that the body utilizes glucose. The energy that we all have, that we're able to walk, do work, is derived from glucose that the body burns to provide that energy. So if for any reason the body is not able to metabolize this glucose, it leads to a condition that result in the blood accumulating glucose, a condition we call hyperglycemia. So if you
high.
Hyper high, and then glycemia.
Yeah,
Sugar.
Okay.
So diabetes is a condition characterized by hyperglycemia.
Okay.
And it's also as a result of the body not being able to utilize glucose due to a substance or a hormone that we call insulin. So the body accumulates sugar, and all the symptoms and signs that follow will be the result of this accumulation of sugar in the blood.
Do we have to eat a lot of sugar to get diabetes? Simple sugars or sweets?
Right. So we have two types of diabetes mellitus. The type 1 and then the type 2.
Okay.
That's the main types. Of course, there may be other types which are less common. You also, in fact, you also have gestational diabetes that occurs
during pregnancy.
In fact, second half of pregnancy.
Okay.
But that normally resolves after delivery.
Okay.
So the two main types, the type 1 and then the type 2. The type 1 diabetes is often called juvenile diabetes.
The type 1?
The type 1.
Okay. Juvenile, like in childhood?
Yes, that affects children, young adults.
Okay.
That one is due to an autoimmune disorder. You see, the substance, the organ that produces what I called earlier insulin, that hormone.
Yeah.
There can be a time that the body will rise, the body cells will rise against that organ.
Okay.
That organ.
The organ. Okay.
This is what we call autoimmune destruction of the pancreas.
Okay.
That will lead to the pancreas not being able to function or produce the hormone insulin.
Okay.
So it's not like you are eating a lot of sugar to get that one. You don't have to eat a lot of sugar to get your pancreas destroyed. It's an autoimmune kind of reaction or mechanism.
Okay.
Then we have the type 2.
Okay.
That one, the pancreas is there. The body is able to release insulin all right, but the cells themselves, the body cells, are not sensitive to the insulin. A condition we call insulin resistance. In other words, the cells have developed resistance to insulin. That is the type 2. So there, of course, there may be risk factors for both. So coming back to your question, not necessarily
eating a lot of sugar. But you said the type 1 is mostly juvenile onset. Yeah. It means that younger people can also have...
Mostly affects children and then young adults.
How young?
Oh, normally about... we have what we call the neonatal diabetes. That one is...
newborn.
For the newborn, it's less common. But the juvenile diabetes, maybe from 5 years.
Preschool.
I mean,
but is it as a result of anything they do?
The person is not born with it, but somewhere along the line, early in childhood, the person gets it. And like I said, the cause is actually not known.
Okay.
But what we know is that the pancreas is destroyed by a process that I termed earlier as autoimmune kind of system where the body cells rise against its own, and then the pancreas is destroyed. And they can have a genetic component, can have a family, there can be a family history to that as well. And certain types of viral infections have also been implicated to aid in that process.
Daryl, I heard you whispering.
Oh, he mentioned there were some viruses that could occur in early childhood that could lead to the type 1 diabetes, and I wanted to chip in that yes, it contributed. So like the rotavirus, for example, is one of the viruses that can
affect.
Yes, affect.
So if somebody is infected with rotavirus, the person has a higher risk of getting juvenile onset diabetes or type 1 diabetes?
It plays a role, it factors into it. So for juvenile onset diabetes or type 1 diabetes, he mentioned there are a lot of factors that play a role in, but we cannot really pinpoint what
that
exactly
this is the point or the cause.
Okay. But what's the underlying factor that runs through it all is the destruction of the cells that produce the insulin. So that's where it comes in, where the body does not produce any insulin at all. So now the patients that have the type 1 diabetes have to take supplementary insulin to ensure that they can metabolize the glucose to gain energy.
So, World Diabetes Day, 14th November. Why do we commemorate this day? Is it that high? Yes, you can come in.
So diabetes is one of the most common chronic diseases, and the type 2 especially is what we look at affecting a lot of adults over 45 years. And when we look at the general population, I think over 40%, Doc, if I'm not mistaken, of the adult population have the type 2 diabetes. And so there's the need to create awareness for this disease. And an interesting fact is that 4 in 10 people don't know they have diabetes, because
4 in 10 people, so about 40%, doctor?
Yes, don't know
they have
diabetes from the population that have. And it's because the early signs and symptoms are not present.
Okay.
So it can be asymptomatic, where they don't know, no signs and symptoms show till it's too late. So it could have been reversed if they noticed earlier, but they wouldn't see early signs and symptoms for them to take action to put this in place. That's why we advise that as adults growing up, you should participate in routine checkups in the hospital.
We'll come there, Daryl.
No problem.
Yeah, so just to add to what he's saying.
Okay.
In Ghana here, I think the WHO estimates prevalence of diabetes, especially the adult onset the type 2, to be about 2.4 million people with diabetes.
Is it the adult population?
Yeah, the adult population. I mean, if you say prevalence, in fact, we are talking about with respect to the population of Ghana.
Okay.
That is to say,
generally,
about maybe 3 to 6% of the population. So for every 100 people, we may get about 5 or 6 people. But he mentioned a figure, but I think there's inter-regional variation.
Okay.
In some areas, some region may be very high, others too, it may be low. But that's the prevalence about.
I hear in Greater Accra is higher than that of the northern parts of the country.
And it's all, I think it can be explained by the fact that it's a disease of rapid urbanization. You know, the more a country urbanizes, the more the incidence, because it's a disease of also, I would say, a sedentary lifestyle. Because in the past, when people used to do a lot of activities, walking, you know, increased physical activities, the incidence used to be very low. But with rapid urbanization, you see, from here to there, instead of person walking,
take a car.
You now can even stay at your home and order Uber or what you go to come to your doorstep.
Yeah.
At first, we're even going to the roadside, but now we are no longer going. And our lifestyle habits too is not also helping. So our eating habits, our way of life, they are all contributing. So I would say that the disease is rapidly increasing.
Is that the reason why it's diabetes in the workplace? Is it because of the sedentary lifestyle? That is why this year's Diabetes Day theme is on workplace and diabetes?
I think so. I think it would play a role in that, because like he mentioned, it's linked to urbanization. So if we look at the job opportunities that are present in the country now, and you mentioned in Greater Accra is higher. So if you look at the jobs that are readily available in Greater Accra compared to maybe the other regions in Ghana, comparatively, we have more corporate jobs here, where you find an office job where you sit to work behind the computer, use the computer for a long period of time. You are not moving around a lot. Maybe you go out for your lunch break, you come back to eat. You are right behind the computer.
Some people will be sitting behind the computer, just instructing people. You take this, you take, even just picking a paper from a shelf, they will still instruct.
Yeah. So our bodies are designed to use the glucose we take in for energy. So if you consume it and you are not utilizing it, it tends to store it. And then it leads to obesity, because when you don't use the glucose you consume and the glycogen stores are full, then they are stored as fat. And fat has been linked to diabetes, the type 2 diabetes. And so that is why sedentary lifestyle plays a role in the type of diabetes you can get. And especially with the corporate jobs, it's linked to type 2 because of the increasing population of obesity as well.
Yeah. That brings us to the risk factors. And we know that we've mentioned something like family history.
Doctor, you will get to the risk factors, but I wanted to go back to what you mentioned about the type 1 and type 2. And he's talking about the fact that type 2 is more of lifestyle. So does it mean that type 1, if you have it, if you would have it, you will have it? No matter what you do, you would still have it?
Because we said that the cause is actually unknown.
Okay.
And by that, what we mean is that if you have two people who are born, you cannot predict that this one
will have type 1.
Will have it. Or,
yeah.
Then I'm talking about the type 1.
Okay, the type 1.
Something that you cannot predict since the cause is unknown.
Okay.
We have diseases like sickle cell disease, whereby if both patients have the sickle cell disease, you can predict that all the offspring that they give birth to will have sickle cell. That
have either some traces or
that one there's a higher predictive value.
Okay.
You can predict, but with this one, because it's not inherited in genetic pattern, you cannot say that this one or that one will have it. But what we are saying is that there's a familiar tendency that if one of the parents or if diabetes is present in the family, then the one who is born into that family is at a higher risk than the one who is born into a family that doesn't have it.
Okay. Okay. So that is with the type 1 diabetes. So now let's look at the type 2. We were talking about risk factors.
Yeah. So the type 2, as I said, is not a problem of insulin. The type 1 is a problem of lack of production of insulin, because the cells that the pancreas that produces the insulin is destroyed. The body has destroyed it. That's what we call autoimmune disease. The body itself has destroyed it, or like you say, some virus can also be implicated. But talking about the type 2, where the insulin is there, but the cells are not sensitive to it, there are risk factors. First of all, I think I mentioned the family history. You had a family history, and you also mentioned something like
sedentary. Okay.
Obesity. You see, it's ideal to maintain,
some body weight.
I think an ideal weight, BMI between 18 or 25, between 18 and 25. Obesity has been known to increase insulin resistance. And then we also have other factors like diet. That's where the diet also comes in. Nowadays, the diet, people take a lot of unhealthy diet.
Fast foods,
unrefined sugars, and so on and so forth. So if you come from a family that has a family history of diabetes, you are also obese, and you are also not eating well, then you increase your risk of having type 2 diabetes. You also have, if you have also had a what we call gestational diabetes. Gestational diabetes comes during pregnancy and resolves after pregnancy. But if you have had it before, it also increases your risk.
So with gestational diabetes, does it affect the fetus or the mother?
It normally affects the mother.
Okay.
It affects the mother.
Okay.
But of course, if the mother produces a lot of like insulin. If the mother takes drugs that affect the sugar level when the baby is born, the baby can also be affected. Not that the baby will have diabetes, but the baby will have a condition that we call hypoglycemia. The baby will have a very low blood glucose. So
naturally have low blood glucose, or it will be for a period where it will be corrected?
You mean the mother?
The baby.
The baby will have a low blood glucose, which will be detected at birth, but it can be corrected.
Okay.
Once it's corrected, that's the
That
end.
will be it. Okay.
But normally, due to the drugs that the mother takes during pregnancy to control the diabetes. So when the baby is born, now the baby is on its own. So there's no, maternal mechanism to, regulate the baby's glucose. So when the baby is born, the baby is on its own. So you detect it. In fact, the baby will show signs of hypoglycemia, that's low blood sugar. But it's very, very treatable, very, very manageable. You give the baby glucose and the baby will be fine. So apart from the gestation, the other risk factors also include, I said, sedentary lifestyle. You've mentioned it.
Yes.
And then the fact that
you've mentioned obesity.
Stress also increases the risk of you having type 2 diabetes. Stress.
Okay.
There's a lot of stress in the system. People are thinking of so many things. There are a lot of people, they work throughout the day, throughout the night. Sometimes they don't even go on leave. Even I'm talking about those who are in official employment.
Yeah.
They don't go on leave. So much stress on them. And stress increases your level of a hormone that we call glucagon, cortisol, which increases your blood sugar. So if you are into a family that already has that risk factors and you also have that stress, your tendency of developing type 2 diabetes is
high.
And also, rest, stress, rest, all these things help the body to regulate insulin. Lack of exercise. Once you exercise, during exercise, the muscles activity pulls a lot of glucose into the cells. So even if you already have high blood sugar and you exercise, without even insulin, the tendency that the uptake of glucose from the blood into the muscle cell is increased.
Okay.
So that in itself will help you to control. So lack of exercise, together with all the other factors that we've mentioned, puts you at an increased risk of developing type 2 diabetes.
Great. So how do we prevent stigma at the workplace? Like preventing stigma of people who have diabetes at the workplace?
Well, I think this shouldn't be a problem at all, because diabetes is not
an infectious
yes,
or communicable
in part of the world.
Yeah.
People put a lot of stigma on infectious diseases.
I think other things that they can see very clearly.
Yeah.
So it's not like it shows on your face that you have.
Yeah, diabetic.
Yes.
And from what I've said, you can have it whether you are, how do I say it? You don't have a say in it. You don't have a say. As for infectious diseases that people put stigma on, it's like you have gone to acquire your problem.
And this one too, you have gone to live a sedentary lifestyle.
That I talked about.
Yeah.
I told you that you don't have a say in it.
Okay.
Your body starts, due to some unknown reason, your body starts producing antibodies or start destroying your pancreas. And then there's a family history. You are born into the family.
Yeah.
That family, maybe the insulin resistance is high.
It's
high in the family. Runs in the family, you don't have a say in it.
Yeah.
So I don't see why people should put a stigma on it. It's also like having hypertension. You see, these ones, they may come naturally because it runs in the family. But of course, your lifestyle habit too can be implicated.
Can also be
But I don't think people will have to fault you because you are not eating well.
And if you are diabetic and you apply for a job, probably they might. Is there any correlation between diabetic patient and getting a job?
So I think there are some instances where people try to avoid that because of some of the complications of diabetes. But I think enough awareness has been raised for people to know that once you manage the condition properly, it shouldn't be something you should be worried about. I think a lot of these jobs are factored into maybe jobs that require you to use your eyes, maybe jobs that require some long hours. I think the army and things don't take people that have diabetes. And I'm not too sure. I think there's some stigma behind that, but I think
is it?
I think it's because of some of the complications that can.
So what are the signs? What are the signs and symptoms of diabetes?
Okay, so some of the common ones are thirst and then frequency in urination. So I think Doc would want to shine more light. Otherwise,
yeah. So like you said, we have the 3 Ps, the triad of symptoms, very, very, very classic. That every health worker knows.
Yeah.
And I'm sure a lot of the patients themselves, they know. We have what we call polyuria, polydipsia, and then polyphagia. The polyuria means that you are passing excessive, like he said, excessive volumes of urine. And then, of course, once you are passing excessive volumes of urine, your body is dehydrated. So you'll be drinking.
Feel thirsty.
You feel thirsty, you'll be drinking a lot of water. And then the polyphagia means that you are eating a lot, either in quantity or in frequency. And it all can be explained from the pathophysiology I mentioned. Glucose stays in the blood. It's not gaining entry into the cells for the body to metabolize to get energy. You know the fuel that we put in our car?
Yeah.
The fuel has to be burnt. For the car,
the car has to move around.
For the car to get energy to move.
Okay.
At this particular case, there is glucose in the blood, but it's not gaining entry into the cells. It's only when glucose gains entry into the cells that it is metabolized for the energy in the food to be released for you to do work. So, because it's not moving into the cells, you are eating, but the cells are not getting the food. That's why they call starvation in the midst of plenty. So then the body, the brain will tell you that you are hungry, you are hungry. So you keep on eating. Meanwhile, the food or the glucose, which the body needs to burn to get energy into the cells, is not entering because of the lack of insulin. The insulin has the key to open the cells so that the glucose can enter the cells to be burnt to provide the energy that you need to do your activities. So the polyphagia or the frequent eating is explained.
Okay.
Then the polyuria.
The last P, polyuria.
Polyuria, you know, glucose in the blood is filtered through the kidney. The glucose stays in the kidney, the urine, and it draws blood. You know, it's an osmotic active substance, the sugar. So wherever it is, it draws blood. Like even when you take sugary food, immediately your body craves for water.
Yes.
Because the sugar is drawing water. So you'll be passing copious amounts of urine. And then that's the third one.
Yeah, then
so we have the increased passage of urine, increased thirst, that you drink a lot of water, and then you eat a lot. That's the 3 Ps. That's the triad of symptoms. Very, very classic. Then the next ones will be, as a result of that, you become weak. Because you are getting dehydrated, your body is losing a lot of water, you become weak. A condition we also call easy fatigability. You walk small.
You are tired.
And then those are the immediate signs and symptoms that everybody will recognize.
Some lose weight.
Some people wait. There are some people who still deny. Sometimes you tell them that is diabetes, you urinate a lot, you drink, but me, I drink a lot of water. That's why I'm urinating. Say, we all drink a lot of water, but that's not how we
urinate.
So go and do the test. Sometimes I have to convince them before they go. But once you notice this triad of symptoms, you are about 80% or 90% sure that the person will be having diabetes. Then later on, there are some people too who may not have these signs, but they may be subtle. they may complain of maybe tingling sensation, numbness, and other things. Then, based on that, you go and check, and then you realize that they have diabetes. So the signs and symptoms come from both the patients and then what the doctors, the medical people, we also see. So once the patient agrees to the symptoms, we also do the signs backed by lab, and we're able to diagnose the condition.
I want to shine more light on, you mentioned the weight loss as well. So Doc mentioned that when you consume food, it's converted into glucose, which is taken up by the cells to produce energy. So once you consume the food and it's not being taken up the cells, it signals to the brain that, oh, we are not getting the glucose. So when you are not getting glucose to produce energy, the body tends to find other sources to produce energy. I said earlier on that when you consume a lot of glucose, it's stored in the body as glycogen, as fat.
Okay.
So if you don't get the energy from the glucose, it takes it from the glycogen stores. And then once that is depleted, then it will turn to the fat. So that's what causes the people to lose weight when they have diabetes. So it has to find energy from the fat. So start breaking down the fat to produce energy, and that is what results in the weight loss.
Great. Well, you are in Consulting Room 5 with me, your host, Dr. Sue, with Farm Darrell and Dr. Yeboah Kessy. We are discussing World Diabetes Day, the causes of diabetes, and then how the symptoms of diabetes. So Dr. and Farm have explained to us how when you see certain symptoms or certain signs, you don't have to be at home. We'll take a quick commercial break, and afterwards we'll discuss how to manage diabetes, how to even know that you have diabetes, what to do, and also look at some of the things that the World Diabetes Day is commemorating with. So don't go anywhere, stay tuned, we'll be right back. Welcome back. You are in Consulting Room 5 with me, your host, Dr. Sue. We are discussing World Diabetes Day, diabetes at the workplace, changing the narrative, and also taking off the stigma. What are the causes of diabetes? What are the signs, symptoms? How do we manage all that? We are discussing all this today, World Diabetes Day, 14th November. And we have Farm Darrell, and then Dr. Yeboah Kessy. You're welcome back, Dr. and Farm. So I would want to find out how one may know that he or she has diabetes.
Thank you very much. Like I said before, diabetes normally presents with classical signs. It's in fact one of the few conditions that will present as very, very classical sign that we all know of. That I mentioned some, like you urinate a lot, you eat a lot, and then you also drink
a lot of water.
So I mean, like I said, we all do, but these ones that I mentioned, they are in excess. You are eating a lot. Sometimes the patients themselves even admit to the fact that they are eating a lot, yet they are losing weight. When all these things happen, it draws the doctor's attention to the fact that it could possibly be diabetes mellitus. As I told you, there's another one, the insipidus, but that one is different from diabetes mellitus. But they have similar presentation. But that one is not related to sugar metabolism. And that one is
so when you see that you are frequently, sorry for cutting you, but I want to chip this in first. When you see that you are frequently urinating, do you have to taste the urine?
Normally people, before they come to you, they might have tasted the thing themselves. So they will tell you that when I tasted the thing, it tasted so sweet. In fact, the name diabetes mellitus, I think, derives from the fact that the urine tastes sweet. I think that's how they combine the word and get the diabetes mellitus. As against diabetes insipidus, where the urine tastes insipid. That one is tasteless.
Okay, so it's
so
mostly
the patient
urine.
But I don't think you, the doctor, or you, the health worker, will tell the patient to go to taste. That one is not in our mandate. But what we do is that the moment the patient mentions that, and even tells you that the urine tastes sweet, you still have to confirm. So you go to the, you let the person do some simple bedside test or lab test. They go to the lab, they do their, if the person has eaten, most of the time, because they don't know, they would have eaten. But even then, you have what you call random blood test that you can do.
Okay.
And then if the person hasn't eaten, then you do what we call fasting blood sugar. So once you test and then you find out that the value is above the recommended range.
What's the recommended range?
The recommended range for fasting blood glucose, I mean, various labs give different readings, but normally between 3 and 6.
For a normal person?
A normal person, fasting blood, about, some give it at 3.3 to about 6.5. But different labs give different, but very, very close range.
But after 6 is a ready.
I'm saying that it depends on the cutoff point for that particular
laboratory.
So they always tell you,
okay,
they will tell you that the person's fasting blood sugar is 6.4. But our range is maybe 3.5 to 6.5. Then you know that the person within range. But other labs, they will tell you that their cutoff point is 6.3. So if the person even has 6.4, then
is there any lab that their range exceeds 7?
No, I haven't seen. It's close. It's closely.
Can we do fasting blood sugar at home?
Oh yes. That's why I'm saying that now we have rapid tests that people have, especially if you know you are at risk. You are at risk of having it. You can buy your own kit.
Okay.
Yeah.
This is a glucometer, right?
Yes.
Yeah, it's a glucometer.
Yeah,
okay.
you can.
AccuCheck.
It's very, very easy to use. You just need the machine, and you just need a prick, a lancet or something to prick the finger, and then there's a strip that you put the blood on. You insert into the machine, and instantaneously the reading comes.
Farm Darrell.
Yes, please.
Can you demonstrate to us, since you're a pharmacist? So this is, please sit down. Yes, I'll just pass it to you. So this is a glucometer. Kindly
let me
just quickly demonstrate it so that anybody can be at home.
Okay. So
and then check.
So most of the glucometers on the market now are marked with the standard treatment guideline ranges, where if you are testing for your fasting blood glucose, the normal range is usually between below 5.6. So about
below 5.6
million.
Okay.
Yes.
Okay.
So, and if it's between 5.7 to 6.9, that's pre-diabetes.
Okay.
So when you get, I don't know if I should talk about pre-diabetes now, if it's fine.
Yeah, quickly talk about
it. From what he's saying, I think different glucometers and then different labs, they have their range.
Yeah.
But wherever you take the sample, they should give you their reference range.
Okay.
So
if you are taking the sample from your home, like you have a small AccuCheck machine, glucometer, what should be the range?
So that's why I said most of them are comparative to the standard treatment guideline ranges. So for fasting, it should be below 5.6. So similarly, 5.6.
Yeah, I'll just give it up to like 3.3 to 6.4.
Does it also depend on the age?
Yes.
Let's say somebody who is in his or her 50s or 60s cannot compare to somebody at the 30s.
Normally, it's like, you see, the range is big enough. So
okay.
That doesn't normally depend.
Can swim in there from 3.
You see, the range is big enough. From 3 to 6, there you see it's a big range.
It's a big range.
So we don't allow for age and other things.
Okay. Okay.
You must be within the
please pick them and then let's see how it is.
No problem at all.
Okay.
So when you take a pack of AccuCheck, the glucometer pack contains the machine itself. So this is what a glucometer looks like.
Okay.
It has a screen that displays the So it has a screen that displays the readings.
Yeah.
So you pick up. The pack also comes with a set of strips.
Okay.
So there are some strips in there as well.
Let's see how the strips look like.
They look like thin films of paper.
Okay.
Yes. So this is what they look like.
Okay.
And there's an insert where you put the strip.
Okay.
So you push the strip. There's this side up. It has an arrow to show you what side up to put into the machine.
Okay.
So you push that strip into the machine, and then as soon as you do that, the machine turns on. So I don't know if you can see the screen.
I can see that.
It's on now, and you see it's blinking with a drop. So it's waiting for you to put the drop of blood on the strip to test.
Okay, so
there are some lancets in the machine. Yeah, I took them out.
Oh, okay.
The machine comes with lancets as well.
Oh, that's great.
Yes. So I don't know if I should open.
You can, but you can't prick me.
No, could you want to?
No.
So the machine has some lancets as well attached.
Okay.
So you take the lancet, you make a small prick on there.
So you have to clean your thumb or whichever.
Yes. So for before you do it, I, the health professional, have to like clean my hands.
This is a home.
Yes. So if you are using it yourself, you just wipe. Use an alcohol swab, or you can use cotton wool with alcohol to wipe the finger you are choosing to prick, and then you make a small prick. So it's very easy to use the lancet. It's just one prick, and then the blood comes out. So you squeeze.
Will it pain? Is it painful?
It's not painful.
Okay.
That's the perception people have. Even if you look away, you might not even feel it.
Okay. It's like a pinch.
Yes.
Okay.
Very small pinch.
Okay.
And then once you take the drop of blood, the new strips come with capillary action. So you don't have to put the blood at any particular place. Once the base of the strip touches the droplet on your finger, it absorbs the blood and then takes it into the machine for the reading to be gotten. So once you do that, it will display your reading and then pair the
range
you are
reference.
using. If you've eaten, then you use the random range.
Okay.
And then if you haven't, then you use the fasting range.
Okay.
And then you know whether you are normal, whether you are pre-diabetic.
Let me have a look at it. Oh, this is so cute. Okay, this is AccuCheck.
AccuCheck Instant.
Yes,
please.
Glucometer.
Yes, please.
Oh, it looks simple.
It's very simple.
Okay.
It looks simple, but it's quite a powerful machine.
Okay.
So compared to the other glucometers you find on the market, this one stores the glucometer readings. And there's something we call glycated hemoglobin, which is the gold standard to test as to whether or not you have diabetes. Whether you check for the fasting blood sugar or the random blood sugar, you can have an idea of whether or not your sugars are high or low. But if you use the glycated hemoglobin, it confirms that you are either diabetic, pre-diabetic, or normal. And those readings are usually taken.
The glycated ones are the ones that covers like 3 months?
Yes, okay. Yes. So that was about to say those readings are usually taken for about 8 to 12 weeks. So that's about 2 to 3 months.
3 months.
But because this machine stores the readings, it can calculate the glycated hemoglobin for you after the 3 months.
So will it backdate or postdate?
It would do the calculation based on your readings. So it's from the prior readings.
Okay.
So once it's being stored in the machine, you can just calculate it for you after you use it for 8 to 12 weeks.
Oh,
so you don't have to go and get
I get it now.
After.
Okay, so to be saved there, then
you.
The next time you do it, then it checks for the glycated.
Yes. And you can connect it to an app on your phone, so you can easily access the readings. Yes. You see, it looks simple.
This one is high-tech glucometer. Okay, so this is AccuCheck.
AccuCheck Instant.
Yes. Okay, so it's good. Why is it? How can I get it?
You can get it in all the pharmacies. We tried to run a campaign when it came, where we tried to give free glucometers out whenever you bought the strips, so that the pharmacies, the individuals that are buying can sample and attest to the fact that AccuCheck is a good brand. And it's a well-known brand worldwide.
Okay.
Now, I think all chain pharmacies you find, I think all pharmacies are close.
Okay.
You find it.
Okay. Okay,
so just to add to what you said about the glycated hemoglobin.
Okay.
In addition to the fact that you mentioned that it can tell you your diabetes status, it's also used to check on the control of your diabetes for the last 2-3 months.
Okay.
Because what we call hemoglobin A1C.
Yeah.
We check hemoglobin A1, that's the glycated hemoglobin.
Okay.
You know, there are some patients, when they are about to come to the hospital, they quickly take their medication.
So that it normalizes. Okay.
The doctor will say that, oh,
well done, you are improving.
At home, they will not take.
Okay.
But when you check the glycated hemoglobin, that's hemoglobin A1C, it gives an idea of how the person has controlled his sugar level at home for the past 2 to 3 months. So it's also a very useful tool that we also use. For the
glycated hemoglobin.
So the fact that the person has come, who is before you, is now showing a glucose level, fasting glucose level of 5, does not mean that that is how it is.
The glycated hemoglobin is the one.
Tell you.
Oh, that's great. So it's important that we all get glucometers, and for any glucometer, AccuCheck is the best for you to get. Okay, enough of that. So have you got a sore throat or a dry cough? Don't let it slow you down. Just get yourself a Lozati lozenges. So Lozati, this is also for the low sugar Lozati. Okay, that's very good. Oh, Unicom Chemist is the main producers of Lozati lozenges.
Lozati is also available in all the pharmacies across the nation. You can get it in all chain pharmacies and all regular pharmacy shops across the nation. And like we said, because we are commemorating World Diabetes Day,
right?
Lozati has sugar-free packs.
Okay.
So they are safe for your
propolis
patients. So the propolis and the strawberry are sugar-free.
Okay.
Yes. So
this is peppermint.
This is peppermint. So this is regular lozenge.
Okay, okay.
But the sugar-free ones have a sweetener which is relatively safer for diabetics to take.
That's great. Nice to hear. Okay, so how do we manage diabetes at all, doctor?
So once you are diagnosed with diabetes, or once you have diagnosed you to have diabetes, we have to manage you. And management usually involves medication and lifestyle changes and a whole lot of preventive measures that we have mentioned. And we have a lot of medications, and it's based on the cause of your diabetes. As I said, you had the type 1, and then you have the type 2. The treatment, they are not
different.
And the type 1, you are not able to produce insulin at all. Your body is not able to. So the mainstay of treatment is insulin injection.
Okay.
You need insulin throughout your life. You have to take insulin. So you treat the person. If the person is not in a state that needs admission, sometimes it depends on, and also depends on the state at which you see the person. Most of the time, they may come in a very bad state, because these conditions, sometimes it doesn't do anything until they realize that they are in serious trouble. Some become unconscious in a comatose state. Then you know you are in trouble. You have to admit, for that patient, you have to admit them. They may be dehydrated. You have to rehydrate them. Okay. And then
like managing it at home. So we have to check our diet. We have to exercise.
Then if once you stabilize the person and the person is going home, it means that's home management. You give the person their medication. If it is insulin, you teach them how to administer the insulin.
So we are talking about like the person going home. How does the person manages himself or herself? For the health personnel, she's been trained or he's been trained. So how the person manages?
So if the person is going to use insulin, you teach the person how to inject the insulin, and then the dose that the person is going to take, depending on the level of.
So we shouldn't skip the injections at home. We should try and keep it. Yeah,
because the person cannot come to the hospital every day to come and take the injection. So you have to teach the person, or if it's a child, you teach the mother or a close relative, somebody, the caregiver.
Yeah, so Daryl, sorry for cutting you. So Daryl.
So for most of home treatments, aside your medication, the lifestyle modifications to play a large role in that. So like you mentioned, diabetes is usually caused by a sedentary lifestyle. So you get the patients to actively move. You get them to change their lifestyle, their diet as well, in addition to the medication. Because if you are taking your medication and the lifestyle is still the same, it sort of crosses out. So you modify your diet, you modify your lifestyle, incorporate exercise into it, and then take your medication judiciously.
So what like I said, we have 2 types of medication, the injection and then the oral ones. And the injections are mostly prescribed for the type 1.
Okay.
And the type 2, normally they are managed with the oral ones, of which we have a lot. So
we shouldn't go to the herbals and all those things, or because I hear they have one-stop diabetes and all those things. What's your take on that?
I normally advise patients that the conditions that we have treatment for at the orthodox facilities, health facilities. Why do you have to go herbal? We haven't told you that you are not able to manage it. So why go? Even the one that we are managing for you at the facility. Sometimes you even find it people say too many drugs, it's too much, but yet they get money and then go to buy the herbal ones. Meanwhile, I haven't told you that we are tired of you or we cannot treat the condition. So why do you add the herbal to it? So those conditions that we're able to treat, we give you your drugs. You have to take them, and then come for regular checkup. And then
so when you are giving your medication,
and the fact that you are giving the medication doesn't mean that is what you have to take forever. We always have to modify.
So you should come for medical reviews every time. Okay. Your last words, Daryl.
So
for diabetes, people who have diabetes, and those who have heard it but haven't been checking and all that. Yes.
So I would want to say that because of the prevalence of the disease, you should know the state of your health. Okay. And it's important that you check, whether at home, whether in the pharmacies, whether in the hospitals. You can make arrangements to get a machine or check in the pharmacy or in the hospital. And then once you know your status, you know what are the next steps to take for treatment. Doc, would you want to add anything?
Yes. What I want to say is that diabetes is like it presents as a friendly kind of disease, but if you don't take care, it becomes very, very deadly.
Okay.
And if you allow the complications to set in, it's very, very deadly. People have waited and they have come late to the hospital. Sometimes they are brought in as a case of DKA, suffering from ketoacidosis. They are in comatose state. And that one is rapidly fatal.
So we should check ourselves.
You should check yourself and then avoid complications, because long term, it can also give you a lot of complications. It can affect your heart, it can affect your eyes. Cases of sudden blindness has been known due to diabetes. It affects your kidney. A lot of people are now having end-stage renal problem because of diabetes. So it can damage your organs, it can damage your eye, it can affect your blood vessels.
Thank you very much, Doctor.
A lot of complications.
Yes, thank you so much. So diabetes comes in as a friendly disease, but very deadly. It can affect most parts of your organs, as Doctor has said, and Daryl has also said. Thank you so much, my gentlemen.
Thank you for having us.
Let's enjoy the World Diabetes Day. Let's make the awareness. Let people hear about diabetes because of the symptoms and how it affects people, you have all said. Okay, so thank you very much for coming, and we are very grateful. World Diabetes Day, I mean, we are all creating the awareness so you got a sore throat or dry cough, don't let it slow you down. Reach for Lozati lozenges. Lozati brings you fast, soothing relief with delicious flavors like ginger, honey, and lemon, peppermint, orange, and the bold new cola. Watching your sugar? We've got you covered with a sugar-free strawberry and sugar-free propolis, perfect for people managing their sugar levels. Whether you are talking all day or working outside, all you need is Lozati lozenges. It's reliable companion. It's available in all pharmaceutical, and it's also available nationwide. Lozati lozenges, relief that works, flavors you would love, and options that care. Kivo says thank you. So our sponsors, we have Kivo pepper. Have you heard about the new pepper in town? Kivo hot pepper is the new pepper. It is now easier and fast to cook. Those spicy, delicious meals you love with Kivo hot pepper, you will feel the heat and delicious taste in every meal made with Kivo hot pepper. Get yourself some Kivo hot pepper today. Use it for your noodles, spaghetti, shito, stews, soups, you name it, and thank me later. It's available in various pack sizes that is convenient for home cooks, chobbers, restaurants, students, and many more. Kivo hot pepper. Mokusho. This is Kivo. Kivo says thank you. So this is Kivo hot pepper, and they are saying thank you very much for coming to Consulting Room 5 to give us this education. And then we have the stew too. It's also 100% natural. Everything about Kivo is 100%. Every product they produce is 100% natural. So Kivo says thank you for coming. Thank you, gentlemen, for coming. And just go and use it. You would love it. You would thank me later. So go and use it. Thank you so much for coming.
Thank you for having us.
Yes. Thank you for having me. Use Kivo and thank me later.